Thanks very much for your time, Minister. Now, you've signalled a different approach from the government on this, more consultative. Has that been driven by policy or politics?
Well, it's been driven by the need to have a positive and strong relationship with the medical profession, and their feedback to me was that they are very unhappy with the state of play with the scheduled changes that were due to come into effect on Monday. So I've pressed the pause button. We're going to consult. I'm going to talk to doctors, medical groups and the profession wherever they are across the country and make sure that we work together to realise the reforms that we all agree we need to have to the Medicare system, put a price signal in, make sure we have a strong, sustainable Medicare that can protect us into the future.
Did you have to fight within government to get control, to press that pause button?
I wouldn't describe it as a fight. We're a team. We've worked together. I've taken soundings from my colleagues in different electorates across the country. And I think one of the strengths of the Liberal and National parties is that we do, as parties, reflect so many different views from so many different corners of Australia. And look, the approach I took as Childcare Minister was to get out and about. I intend to do that in this role and make sure that the issues that are being presented by the medical profession to me are understood on a one-to-one basis, face-to-face, on the ground where it happens.
The AMA said earlier this week on our program that they hadn't been consulted over that summer period. I understand that you've just taken control of this portfolio, but is that true that the doctors weren't consulted while that lobbying was going on between Labor and the crossbenchers in the Senate?
Look, I can talk about my term as Health Minister. I was sworn in a couple of days before Christmas. I met the AMA on day one. I've had intermittent contact with doctors' groups over the last few weeks, and I've got a lot of meetings scheduled in Canberra for next week. So I'm certainly talking to them on an ongoing basis, and that's clearly important. I don't want to be at war with the medical profession. I want to make sure that we do work together. And we're not going to agree on everything. There are significant challenges, and I can't wave a magic wand and make those challenges go away. But with our ageing population and the strong growth in the spend in Medicare, we all know that something does need to happen. And Labor and the medical profession are on the record as saying we do need a price signal in health, we do need reform, in order to maintain the quality health care that we are in this country so proud of.
Now, you said yesterday miscommunication caused confusion among patients and doctors. I'm interested in who you think is to blame for that miscommunication.
Look, I don't want to blame anyone for anything. That's just not the approach I take. But patients were contacting me and saying, so is this the end of bulk billing? What does this mean for us if our doctor's surgery no longer bulk bills? And there was, and definitely, confusion. Now, where that comes from, I'm not going to speculate.
Well, it comes from the government.
The measure was not about ending.
It comes from the government.
The measure was not about ending.
And I just wonder what lessons you've learned from that, because, and the reason I'm asking this question is because the Australian people will want to know, are you serious about a consultation? The Prime Minister said it was a good package mid last year. He said it's a better package in December, and then you've scrapped that's taking away the rebate.
Well, two key elements of that package remain. This was one that was due to start on Monday that was creating confusion and a lot of anxiety from the profession and from patients, and that's why I've said we're going to press the pause button and consult. Now, it would be a bit of a sham consultation if I knew where it was going to end. So this is a genuine consultation. It's a real conversation. It's something that we will start on immediately, and we will make sure that we work together with the profession. And I know that people of goodwill, and health matters to everyone, and the crossbench is equally important in this as well. So everyone's heart is in the right place when it comes to health, and I'm going to make sure that the consultation that takes place now leads us to strong positive reform of Medicare that makes sense, and by the way, says that if I go to a doctor, I don't just automatically get bulk billed, and at the moment I can. There needs to be that price signal that says somebody who can afford to pay should pay.
Yeah, I just wonder why, if you're talking about creating some sort of clean slate, why the $5 co-payments is still there and the government saying it's still going to press ahead with that and try and get that through the Senate. Why not take that off the table now and then consult and come up with your policy after those consultations?
Look, it is still government policy. That doesn't mean that I'm not keen to hear people's views about it, but broadly there actually is support for a co-payment measure. What doctors were saying to me over the summer break was they were struggling to accept the changes that were due to come in to the Medicare rebate for the short consultations, but you know, they understood the principle of the co-payment. So I think we do have, I know we do have broad support for that. So I will be working with them in how we refine perhaps the details of the co-payment, but the principle of the co-payment is sound, and it's one I think that is going to be supported across the board.
Now, we've spoken to the Australian Council of Social Service today, and they've outlined a couple of points. They think that you should abolish the private health insurance rebate altogether. Nick Xenophon was talking about measures involving palliative care and how that can be fixed a little bit and money saved in that area. I'm interested in what areas of the health system are you also looking at through your discussions with doctors? Where else are you going to look to save money?
Well, across the broad portfolio, there are many things to look at and to consider. My own passion is, if I may say so, preventative health, wellness, making sure that whether it be your physical or your mental health is taken care of so that you don't enter the health system, whether it be through the GP system or the hospital system. And there are obviously better outcomes for you and better outcomes for the budget as a whole. So I will bring that focus to health policy generally. I'm interested in talking to Nick Xenophon. He's got good ideas, and he is one of the key crossbenchers that will, I know, have some of those ideas to feed into this particular process. The private health insurance rebate is a good thing. It's a sound policy, and we do not need to load the public health system up with any more costs. And we know that when people take control of their health, they take out insurance and they visit a private hospital, that takes the pressure off the public system. And we do need a strong public system. It's obviously managed by state governments, but not by the federal government, because key and central to all these reforms is the need to take care of the vulnerable, the need to make sure that concessional patients are looked after, that they are bulk billed, and that's really what our bulk billing system should be doing, looking after concessional patients, and making sure that those with chronic diseases who have to visit the doctor frequently don't find that they are loaded up with additional costs. So these are the things that I will keep front and centre as we develop broader health policy.
Susan Lee, thanks very much for your time. The pause button's been pressed. I guess you'll press play now and get on with that big job, and good luck with it.
Thank you.